A pleasant day to everyone. I am Dr. Jennifer P. Reyes from the College of Nursing, Pamantasan, Lungsod ng Maynila. And on behalf of my co-authors, Dr. Emerson Aliswag, Dr. Minerva de Ala from Philippine Women's University, and Dr. Ricardo C. Reyes III from Universidad de Manila. It is my honor to present our paper entitled Determinants of the Predictors Between Extent of Caring to Patient Satisfaction, a Basis for Regression-Based Modeling. For the introduction, in contemporary healthcare setting, the provision of quality nursing care is not merely confined to clinical intervention, but extend to encompassing holistic approaches that prioritize the psychological, emotional, and spiritual well-being of patient. At the core of such holistic nursing practice lies the caring theory, a conceptual framework pioneered by Jean Watson, which emphasizes the transformative power of caring and fostering healing and promoting overall patient satisfaction. As healthcare systems continue to evolve, there is a growing recognition of the pivotal role played by nurses in ensuring patient satisfaction and well-being. Thus, this study seeks to explore the relationship between caring theory and patient satisfaction as perceived by the patient, to provide insight that can help in the development of the regression-based model for nurses. Therefore, understanding the link between caring theory and patient satisfactions holds immense relevance for nursing practice, as it can inform strategies aimed at enhancing the quality care delivered by nurses. The primary purpose of the studies is to investigate the relationship between the extent of caring behavior exhibited by nurses and patient satisfaction with nursing care as perceived by the patient. By investigating the relationship between caring theory and patient satisfaction, this study aims to bridge the gap between theoretical nursing concept and practical outcomes in the healthcare delivery. Through a comprehensive review of existing literature and empirical research, the study seeks to elucidate the mechanism through which caring behavior influences patients' perception of care and patient satisfaction's level. Additionally, by identifying key determinants of patient satisfaction within the framework of caring theory, the study intends to provide valuable insight that can guide the development of a regression-based model for nurses, equipping them with the necessary skills and competencies to deliver patient-centered care effectively. For the methodology, this study utilized a multi-phase design. The phases included survey correlational research, regressional analysis, and regression-based modeling to identify significant predictors and develop intervention to enhance nursing care. This involved collating data through survey to explore relationship between various caring behavior and patient satisfaction, providing insight into naturally occurring phenomena without manipulating variables and allowing the identification of potential causal relationship. Regression analysis was employed to quantify the relationship between patient satisfactions and caring behavior, facilitating the development of predictive models to understand how changes in caring behavior impact patient satisfaction. Constructing predictive models using regression analysis provided quantitative insight into complex relationships, identifying significant predictors of patient satisfaction and informing decision-making based on empirical evidences. For the resultant discussion, SOP number 1, what is the extent of caring of nurses as perceived by the patient in terms of its aspect? Summary table of aspect dimension, aspect of assurance with a mean score of 3.72, respectful with mean score of 3.49, and overall perception with mean score of 3.42, all interpreted as very good extent of caring, while knowledge, skills, and connectedness with mean score of 3.09 and 2.98, respectively, both interpreted as neutral extent of caring. And the grand overall mean for the extent of caring is 3.34, interpreted as neutral extent of caring. Positive correlations were found between perceptions of overall nursing care and factors such as attentiveness to patient need, effective discharge planning, and coordination among caregiver. This study aligns with Cincy et al. 2019, which highlighted the importance of specific caring behavior in patient satisfaction, while respectful behavior and connectedness have varied responses indicating areas needing improvement. There is a need to address deficiency in respectfulness and connectedness to improve patient experiences. For SOP number 2, what is the patient satisfactions with nursing care? Evaluation of caring behavior, frequent caring behaviors, like treating patient as individual, providing support to patient, both with mean score of 3.86 and involving patient in care planning with mean score of 3.57, all interpreted as usually satisfied. And for less frequent caring behavior, like listening attentively, with mean score of 3.39, spending enough time with patient with mean score of 3.45, showing confidence with difficult patient with mean score of 3.43, all interpreted as occasionally satisfied. By understanding and addressing the factors that influences this behavior, healthcare organizations can enhance patient satisfaction and create more effective healing environment. Further studies should continue to explore this dimension across different culture over time to develop comprehensive strategies for improving nursing care quality. For SOP number 3, is there a significant linear relationship between the patient perceived extent of caring and patient satisfaction of nurses? Summary of correlation analysis, correlation and matrix results, connectedness, which means strongly positively correlated with patient satisfactions, knowledge and skills with a strong positive correlation with patient satisfaction, assurance, moderately positive correlated with patient satisfaction, respectful behavior, moderately positively correlated with patient satisfaction, overall perception, positive association with patient satisfaction. Fostering nurse compassions lead to better outcomes for patient, emphasizing the need for supportive work environment and compassionate care provisions. Correlation matrix provide insight into patient perceived caring behavior and their impact on patient satisfaction with nursing services. The correlation analysis highlights the significant impact of various dimensions of caring behavior on patient satisfaction with nursing care. It underscores the importance of fostering nurse compassion and creating healing environment for patients. For SOP number 4, is there a predictive relationship between the patient perceived extent of caring and patient satisfaction of nurses? Summary of regression analysis, model fit measures, relationship strength model R is equal to 0.706, R squared is equal to 0.499, indicating that about 49.9% of patient satisfaction variation is explained by the perceived caring behavior of nurses. Model coefficients on caring behavior predictors, positive predictors, assurance, respectfulness, connectedness, overall general perceptions. Non-significant predictors are knowledge and skills. Importance of caring behavior. Patient satisfaction with nursing care depends largely on patient perceptions, nurses' attitudes, emphasizing the need for empathy and compassion in healthcare delivery. Predictive relationship shows patient satisfactions with nursing care is significantly influenced by perceived caring behavior of nurses, highlighting the importance of empathy and compassion in healthcare delivery. Number 1, caregiving was significantly predicted by connectedness, respectfulness with higher values reflecting a stronger influence of patient satisfaction through these pathways, while the effect of knowledge skills was not statistically significant, implying Russell's role in predicting patient satisfaction. Number 2, caregiving is directly influenced by respectfulness, connectedness, as well as overall perceptions having a direct impact on care delivery. Number 3, respectfulness indirectly affect patient satisfaction through assurance aspect. Connectedness indirectly affect patient satisfaction via the assurance aspect. For SOP number 5, what regression-based modeling can be developed from the study to determine the predictors of patient satisfaction to improve the patient perceived extent of caring? Summary of regression-based modeling analysis, model info, multi-mediation model utilized to examine how assurance, knowledge, and skills, respectfulness, connectedness, overall perception, among other factors, influence patient satisfaction through the perspective of caring behavior. Sample size utilized in this study is 268 participants. Predictive analysis on caring behavior. These are the significant predictor. Connectedness indicates strongly predict patient satisfaction. Respectfulness also a significant predictor. Knowledge skills, they are not statistically significant, suggesting a result role in predicting patient satisfaction. Direct effects, respectfulness directly influences caregiving. Connectedness also has a direct impact on care delivery. Overall perception directly affect care delivery. For indirect effect, respectfulness indirectly affect patient satisfaction through the assurance aspect. Connectedness indirectly influence patient satisfactions via the assurance aspect. Result of this study, the development of regression-based modeling created regression-based modeling identified predictors of patient satisfaction to enhance patient perceived extent of caring in nursing practice. Model-based intervention program with the title Enhancing Patient Satisfactions Through Caring Behaviors, an interventional program. This interventional program aims to promote caring behaviors among nursing professionals to improve patient satisfaction. The program will focus on addressing key predictors identified through regression analysis, including respectfulness, connectedness, aspect of assurance, knowledge, skills, and overall perception. For the summary of results and finding, patient satisfaction and nurse-patient interactions, positive responses to assurance-related issues, high rating skills for competence and coordinations, positive feedback on instructions, areas for improvements, knowledge and skills. Explanations did not receive high rating, indicating a need for improvement in this area. Analysis of caring behavior dimension, correlations with overall satisfaction. All caring behavior a strong positive relationship with overall satisfaction. Connectedness has the highest correlations with patient satisfaction. Predictive factors of patient satisfactions. Significant predictors are assurance, respectfulness, connectedness, and overall perception of nursing, were significant predictors of patient satisfaction. For regression analysis finding, the regressions model highlighted specific care behavior that significantly impact patient satisfaction. For the conclusion, patient perception of caring. Patient perceive varying level of caring behavior from nurses, particularly the aspect of assurance, knowledge and skills, respectfulness, and connectedness. Status of patient satisfaction. There is a measurable status of patient satisfaction with nursing care that reflects the quality of interaction between nurses and patient. Significant relationship. A significant linear relationship exists between the extent of caring perceived by patients and their overall satisfaction with nursing care. Predictive relationship. The extent of caring behavior exhibited by nurses can predict patient satisfaction's level, indicating the improvements in caring behaviors may enhance patient experiences. And regression-based modeling, the development of regression-based models can effectively identify key predictors of patient satisfaction, providing actionable insight from improving nursing practice. Recommendations for training. Targeted training programs for nurses should be developed to strengthen identified areas of deficiency in caring behavior, ultimately improving patient perceptions and satisfaction. Under nursing education, proposed curriculum enhancement, inclusions of caring behavior, framework for teaching assessment, impact on patient care. For nursing administrations, there's need to be include the strategies for enhancing caring behavior to promote supportive organizational culture that values empathy and caring behavior. Utilize the interventional program as a guide to develop customized interventions that enhance the caregiving skills of nurses at various levels. Implement ongoing mentorship program and reward system to motivate the staff. These strategies contribute to positive working environment where patients' needs are consistently met. And last, integrate patient satisfaction indicators into performance appraisal tool to further foster caring behavior among nursing team. For nursing practice, demonstrate caring behavior, enhance communication skills, enhance professional collaborations, implement research-based intervention. For nursing practice, key practices for nurses needs to demonstrate caring behavior, enhance communication skills, encourage professional collaboration, implement research-based intervention. Another recommendations is need for ongoing research. Continued research is necessary to further explore the dynamics between nursing care and patient satisfaction across diverse healthcare settings and populations. For nursing research, further research is needed to explore the real-life applications of caring behavior across various cultures and their long-term impact on patient outcomes. This can be achieved through comparative studies and the development of new models based on interventions program. Another recommendation is to implement the model-based interventional program with title Enhancing Patient Satisfaction Through Caring Behavior and Interventional Program. Model-based interventional program enhancing patient satisfaction through caring behaviors, an interventional program. This interventional programs aims to promote caring behaviors among nursing professionals to improve patient satisfaction. The program will focus on addressing key predictors identified through regression analysis, including respectfulness, connectedness, aspect of assurance, knowledge and skills, and overall perceptions. These are my references. Thank you very much and God bless.